All right, good afternoon. Thank you for joining this lecture. I appreciate the opportunity to speak for Present. I know they always put on some great topics here. So today I'd like to talk a little bit more about biomechanics and the use of a custom versus a prefabricated orthotic. And I really want people to start thinking about, is a custom orthotic always needed? As a disclaimer, I am a key opinion leader and a consultant for PowerStep, but everything that I always speak about at these lectures, I really try to make just strictly about clinical and my opinions and interactions with my patients. So what's the objectives that we have here? Well, biomechanics is the foundation for many problems that we have, many podiatric problems. So when treating early, utilizing an orthotic may relieve the pain or stop or slow the progression of the symptoms and preclude the need for a custom orthotic. I know that a lot of times we all get patients into our practices who have conditions that are early in their onset, and thinking about it from a little different tack, thinking about it from a prefabricated orthotic versus does everybody need a custom orthotic is really where I want to go with this. So in reality, everybody who's attending this lecture knows when a patient's complaint is related to the biomechanics of their feet, whether it's hallux valgus, plantar fasciitis, pes plano valgus. At some point in our treatment of this patient, the protocol deals with biomechanics and will deal with the use of an orthotic to treat this patient's biomechanics. Because the first thing we're going to do is discuss the long-term outcome that we want for our patients, and then talk about what we're going to do right now. And a lot of times early on in that treatment plan is going to be the use of an orthotic. So what's the question we have to ask ourselves? Does every patient need a custom orthotic at the onset? So a lot of times that's really should be, we think about, is that the question? Well, I really think we need to ask a better question. I don't think we need to ask, does a patient need a custom orthotic? I think, does every patient need to invest in the use of a custom device, or is there something that will benefit the patient first? So now, when I always like to talk about investing in something, especially in today's day of healthcare and what goes on with our insurances, patients have very large deductibles, they pay large copays, and sometimes they have to invest in not only the investment of the orthotic from a financial standpoint, they have to also think about the investment of the use of an orthotic from a clinical standpoint. Sometimes the device that the patient needs will necessitate some investment of time and adjustment into the use of a custom functional device. So what if you're able to provide a patient with a prefabricated device that they can leave the office with, that you feel comfortable enough that's going to provide them with the stability, the functionality, the biomechanical control that they need? That's the better thing that we have to think about. Not do we just have to give everybody a custom orthotic, but what they would need to invest in to treat their biomechanical problem right then and there. So can a prefabricated device treat our patients? That's what we have to ask ourselves. Let's be very honest with ourselves. PowerStep orthotics are clinically proven, and I'm going to talk about that in the next slides, to improve foot function and decrease foot pain. Whether it's pes plano valgus, pes cavus, any one of these, plantar fasciitis, metatarsalgia, any one of these biomechanical conditions you can address with your patients with the use of a prefabricated, good device, good orthotic. In my opinion, yes, I believe the Power Step orthotic is the best prefabricated orthotic on the market. So let's just talk about use of prefabricated versus custom. It's not about believing me. It's not about believing Power Step or any sales pitch. What we have to start thinking about is clinical studies, right? We all believe in studies. We should be. We shouldn't be believing any company. So a study that was done by Springett, Otter, and Barry looked into the use of a prefabricated semi-rigid orthotic to improve foot function, and improving foot function in all the different areas that we just spoke about. So in this study that was published back in 2007, and I don't think that the age of the study really makes any difference, the patients were evaluated at baseline, 4 weeks, and after a year. They found that there was an initial marked decrease in foot pain with the use of a prefabricated device. Patients stated that there was a good fit, there was good stability with the use of these devices, that they were comfortable. They also found that there was some minimal increase in pain after 4 weeks, but with an equal increase, the patients described, in their mobility. That the minimal pain didn't make enough difference because they were happier with the increase in their mobility. And at 15 months, 73% of patients found the orthotics to continue to be beneficial. Again, don't believe me, believe your patients. When patients come in with pain, we have to provide them with a device that can bring them to a better biomechanical place, which will decrease pain. So let's talk about why Power Step. I personally always believe in doing conservative treatment with a prefabricated device before the use of a custom if it is warranted. Again, the Power Step device is clinically proven. You are able to have these devices in your office to provide a same-day solution to your patients. In my opinion, they're affordable, they're convenient. You don't have to scan or mold with the use of plaster. While I still continue to do that in my office, I believe that the use of these devices are made of high quality. And I think that's what's important, because anything you do in your practice, and I talk about this all the time from a business management standpoint, if you're going to ask your patients to invest in something, they're going to invest it based on your opinion of it, and it's your reputation. If you're going to dispense something that is not a quality device, ultimately they're going to look at your reputation of recommending that device. And the Power Step, the ProTech device, is exclusive to medical professionals. Can certain Power Step devices be purchased over the counter in other places? Yes, but the ProTech device is exclusive to you in your practice. The shell is fit for a purpose. It achieves the desired functional control, provides stability. It's semi-flexible or semi-rigid, depending on how you want to look at it, partly cloudy, partly sunny. They are adjustable to allow for modifications. It's slim enough to go in a lot of different shoe gear. It's not so hard, and it has a very good shock absorption. The materials that come with it are cleanable, washable. They're non-allergenic, they're non-staining, they're able to absorb sweat. And again, talk about when you are recommending the use of an orthotic, talk about the use of the orthotic as an investment, because an investment has a return. If something costs something, there's no return on that. Now, this may be the interim solution needed before the use of a functional device. But if not, For instance, this past week in my office, I had somebody come back in who loved the devices and got a second pair just because he didn't want to keep switching them back and forth. So there are a lot of prefabricated devices on the market. So why this one? So the semi-rigid shell leads to less breakdown. There's pain relief and prevention. The semi-rigid arch comes in 12 different sizes. The foam material, which we're going to talk about in just a moment, is a medical grade foam, which would also provide for a longer duration of use. So let's just talk a little bit about the Poron. It's medical grade. It has superior shock absorption. It's superior compression set resistance, and it has superior resilience. So the material that they use on the top, the Poron, is really the defining thing that they have on the ProTech device versus other ones that are even done over the counter. So there are adjustments that are also available. You can get from PowerStep, you can get medial longitudinal arch padding, adjustable heel lifts, 4-foot wedges, 2-degree and 4-degree heel wedges, IPK cushioning, metatarsal padding. So it's not like you're just handing them a device. You can also, quote, customize that device before that patient leaves the office. So what are the patient's benefits of PowerStep? Again, they're clinically proven to relieve pain. It treats the problem, not just the symptoms. Remember, ultimately, we want to do something to control the biomechanics of the foot, which will then decrease pain. It's a fraction of the cost of custom orthotics, as we know. Some practices can charge anywhere from $400 to $600 to $700 for a pair of custom orthotics. Patients get immediate pain relief. There's no waiting. They're comfortable for greater patient compliance. And what are the benefits to you? They're only available to you, can't be purchased elsewhere, the ProTech device. They're convenient just to dispense off the shelf. Saves the staff time and you time without the need to mold or scan. Revenue into your practice, but this also leaves open the opportunity to progress to a custom device. What's been going on a lot now in our world is the use of other things to provide support because patients have been working from home. You know, with the pandemic and life changing, people are working from home. So these are things that I recommend for people to use at home, the PowerStep slides and sandals. You know, you don't want to get them into a device and then have them barefoot at home. I call that getting on the hamster wheel. You get them better, they stop using the device because they're walking home and they get worse again. So the use of the PowerStep sandals or slides is definitely something that should help your patients when used at home. They could also just use them better than the $2 flip-flops that they can buy in some of the stores. It will provide them with some support to the plantar fascia, and if they need that temporary device. Remember one thing, you're dispensing products and you're explaining why you need them, even though they are investing in them from you. You see, I continue to use the word investment. I always tell patients we need to invest in our foot health. Other products that you could dispense from PowerStep, they have night splints. If you don't dispense night splints through the durable medical equipment program through Medicare, this is a good alternative. They have kids orthotics. They have different prefabricated ankle braces that you can also dispense. Remember, this could be an opportunity to have an additional cash flow into your practice if you're not dealing with it from an insurance standpoint. How many times do we recommend patient using compression socks and sleeves for other problems? So what I want you to think about here is put your head on your pillow at night and know you did the right thing for your patients. So what does that mean? Always put your patients first. Feel confident about the products and services you provide. And if you do that, your reputation will grow and patients will continue to follow. I want to thank you very much for taking the opportunity to listen to this presentation. If anybody has any questions that they'd like to talk to me about biomechanics and business management, please feel free to reach out to me. My email is drbass@basspodiatry.com. Thank you very much.